Welcome back to part 2. Now we're going to talk about alternative medicines. Some therapies were once considered ineffectual by the medical community until scientific studies and tests proved them to be effective and safe for use. So some of these examples under the complementary medicine or alternative techniques proven effective by scientific research are acupuncture, massage therapy, and biofeedback. And we also see a lot of people finding results in herbal preparations and things like copper bracelets for arthritis, but those are lacking scientific evidence of the safety for now. But again, there are more and more studies being shown. Herbal therapy is at the very root of pharmacology because herbs and natural medicines were used before manufactured medications were available. So it's important to always remember, we look at Western medicine now, and it really depends on what the provider feels and how much information they've had on things. And we are seeing some Western medicine providers actually acknowledging the benefits of these alternative medicine techniques. So how about you at home? Do you have any examples from your families or personal experience of home or folk remedies where the treatments are devised at home without the professional medical advice? And they're usually passed down from generation to generation. And here it says questionable therapeutic value. And this I see through these home and folk remedies many, many times in many different cultures. People find great relief with these remedies and they pass them down throughout the generations and continue to use them for relief. On this table that I want you to look at in your book, table 19.5, I believe, is an example of some of the home and folk remedies, and many of these remedies coexist with modern pharmaceutical therapies. In the United States, most cultural groups use some form of complementary or alternative therapies. Let's talk a little bit about safety and regulation of herbal supplements. Considered dietary supplements are not regulated by the FDA currently. Always ask the patient about their use of herbal supplements. Instruct patients to purchase herbs from a reputable source, and inform physician of herbal therapy to avoid drug interactions. If an herbal product is natural, does that mean that it's safe? No, it doesn't. And there are many instances where it's true that just because it's an herb and it's natural, it is not safely processed in the body. It's important to ask the patients about the herbal supplements because you want to determine if any symptoms may be side effects of this herbal use, and also to avoid any interactions with any prescribed medications. So again, we're looking at another table, or this is actually a box, it's 19.1, and it's showing the common reasons for use of dietary supplements. And it's important to note that different parts of the herb are used for medical purposes. Here's table 19.7, examples of herbs with a potential for toxic effects. And again, I want you to take a look at this so you have a small understanding of the herbs that have potential for toxic effects. Special care should be taken by patients with allergies and those sensitive to medications and taking medications for chronic illness. Also, those who are over 65 years of age or younger than 12 years of age. If you have any questions, please visit the question and answer board or send me a message. I hope you have a great week and I look forward to seeing you in class in ALH 4. Bye-bye.